Welcome back to Unstable TV! And you're through to Irish Couple Reacts. And do stay tuned because this happens every week.
So if you're new here, don't forget to like, subscribe, comment and hit the bell notification so you don't miss any of these videos. And if you're a returning viewer, thank you!
Thanks for joining us for another react! So Danielle, what are we reacting to on Unstable TV?
So today we're going to be taking a look at USA versus UK healthcare insurance. Ooh, this should be interesting.
Let's go!
Healthcare systems cannot be more different when we compare the United States and the United Kingdom. The United States has the largest private sector system, while the United Kingdom has one of the largest public sector systems. Both systems are highly
did you know that?
Yeah.
and have world-class health outcomes. But the UK healthcare, otherwise known as the National Health Services (NHS), has way fewer health outcomes variation across its population when compared to the US. If you want to discover the main differences between both systems, make sure that you stick around to the end of this video. Healthcare in the US is almost exclusive by private sector providers. Hospitals are owned by either for-profit or non-profit organizations. Most of the people in the US have access to healthcare through a blend of private health insurance, Medicare, and Medicaid programs. Medicare is a federal program that provides health coverage if you are 65 years or older, no matter what.
Okay, that's good.
Yeah.
Medicare also provides coverage for people with disabilities, even if they are under 65 years old. Medicaid, on the other hand, is a state and federal program that provides health coverage if you have a very low income and cannot cover your healthcare costs by yourself. The remaining people who are not covered by private insurance, Medicare, or Medicaid will have to rely on their own financial resources to cover their health and medicine expenses. The United Kingdom healthcare system, otherwise known as the National Health Services (NHS), is an ideal example of socialized medicine and a single-payer healthcare system. This means that healthcare is provided by a single payer, which is the British government, and is funded by taxpayers of the United Kingdom. The appointments and treatments are provided for free to patients, as are most of the prescription drugs. Well, let's re-emphasize that it's paid by taxes, so it's not truly free. But the NHS is not
that makes sense.
There are some services that require patients to pay, such as dental and eye care, but the fees are comparably low to the US fees. The maximum cost of receiving any drug prescribed by the NHS is $12. The United Kingdom does allow employers to offer private health insurance plans to workers. Some of these workers decide to opt out of the NHS and receive their medical treatments privately. It is quite an advantage as
if the company's paying for it, you would.
Specialists, unlike NHS patients. Private patients also avoid waiting lists for non-emergency procedures, while NHS patients tend to wait for weeks or even months. When it comes to accessibility, NHS patients receive their primary care from general practitioners, which are referred to as GPs, who act as gatekeepers for secondary care. When it comes to accessibility based on age, the National Institute for Health and Care Excellence, otherwise known as NICE, consults Citizens Council to help it sort through difficult ethical issues such as prioritization of patients based on age, which is simply not allowed in the UK. Patients of all age should receive the same degree of access to the healthcare system. Now let's compare the US and UK healthcare system. The United States spends more on healthcare than any other country. When compared to the United Kingdom, the expenditures of the US healthcare system are approximately double the expenditures of healthcare system in the UK. It is worth mentioning that the United Kingdom's NHS services have a low cost when compared to other developed nations, according to the World Health Organization. UK spends around $4,000 per person, while the US spends $10,500 per person.
Because the hill was a reliable source.
That the United Kingdom spends around 9.8% of its GDP on healthcare, while the US spends 16.9%. That's a massive difference. There's always a trade-off for a low cost. The NHS is known for slow responsiveness time. When compared to the US healthcare system, which ranks as number 1 for responsiveness, according to the World Health Organization. The US healthcare system is responsible for populations' wants and needs. The UK healthcare is financially constrained, which will result in wants to be constrained. This is seen in the form of a long waiting list for non-essential medical care, which is required by people in the UK, and obviously this is meant
A long waiting list?
waiting times. NHS patients wait an average of about 8 weeks for treatments that require admission to a hospital, 4 weeks for outpatient treatments, and 2 weeks for...
But that's not even that long compared to Ireland.
When it comes to
No.
life expectancy and infant mortality, the UK has a better ranking than the US. UK citizens have a longer life expectancy and lower infant mortality. In 2017, life expectancy in the UK was 2.7 years higher than in the US.
My baby is the same
And
hairstyle as me.
infant mortality is lower in the United Kingdom, with 3.9 deaths per 1,000 live births, as opposed to 5.8 in the United States.
That's a huge
The UK has
difference
a
in
more
numbers.
acute care hospital beds per capita, and fewer deaths related to surgical or medical mishaps. So you can clearly see how both healthcare systems are different from each other. They both have pros and cons, since they follow completely different philosophies. Tell us what you think about these different healthcare systems in the comments section, and which one do you support? If you like this video, make sure to demolish that like button, subscribe,
Demolish
it.
Now,
notify
demolish is the like button. Demolish ours too. Dude, what did you think of that, Governor?
Like an 8-week wait time compared to the wait time in Ireland is not long.
Not at all.
No.
You ever been in a wait time?
Yes, I've been on a wait time. I was on a wait time to get my tonsils taken out. I was on the waiting list for 5 years. I just ended up taking myself off them because I wasn't waiting another 5+ years to get them out. But it's a long wait list. And there is a long wait list for people that have life-threatening surgeries, which is a bit of a disgrace. But I don't run the healthcare system. I don't know what it's like in the background. I don't know what they have to deal with, so
Yeah.
I can't talk on it too much.
Yeah, from the outside looking in, that's a bit horrible, but like Danielle said, we don't know what to deal with, so we can't really say too much because we don't know how hard it really is for them.
Yeah.
Big shout out to the original content creator, very well put together, very in-depth stats and numbers of everything that was going on between the two healthcare systems, very well described. Appreciate the in-depthness and helping us further understand just what comes into the two comparisons of the healthcare.
Exactly. And if there's anyone that's lived in both countries, because I know there's a lot of people that do that,
Yeah.
can you tell us, if anyone's watching, what did you see as the major differences between the two of them? Because I've heard a lot of bad things about American healthcare, like price-wise.
Let us know down in the comment section. Let us know what your experience with this was around globally. As Danielle was saying, a lot of people visit to and from.
Yeah.
But let us know if there's any stats yourself that might have been inaccurate or you could help us further understand. Would be greatly appreciated.
What do you think of that?
It's just really shocking to see what goes on.
Yeah.
Like, it's good that, you know, the public healthcare system over in England, that's really good, and it's a bit frightening how much money is pumped into the healthcare system in America, and how much you can really see it is a business at the end of the day,
Yeah, absolutely.
which is upsetting because, you know, we all need our health looked after. Our health is our wealth at the end of the day, whether you like it or not. You can look at wherever way you want to look at the world, but your health is number one.
Yeah, and it is so important, and it's so important for everybody to get a chance.
But we don't make the rules of the world.
No.
We're just here talking about it, giving our 2 cents. So we will leave you all with that.
So as always, you are the beautiful people of YouTube, and we have been Unstable TV.
So drop a comment below and let us know what you thought of this reaction video. And if you have any suggestions for us to do, let us know too.
And as always, we will see you in the next one. Bye.